Hi, current and future superhumans. It's Stephen Freeborn from Revolution Strength and Conditioning, where we're building superhumans and celebrating awesomeness. And how about all this awesome weather we've been having in JOMO? It's pretty great. But one thing we're going to see with the weather warming up is we're also going to see a lot of runners getting back onto the road and putting up miles again, which is awesome. It's great to run. It's great to be active and to be athletic. But we want to do so pain-free, and one of the things we see commonly with a lot of our current superhumans who participate in running is anterior knee pain, and particularly that's generalized anterior knee pain. That doesn't really have a specific source of origin. They may have had a doctor look at it or had an MRI or an X-ray, and there's nothing really structurally wrong to explain it. So typically they're diagnosed with patellofemoral syndrome, which is kind of this mystical term for incorrect tracking of the patella and the femoral groove. And what we've had a lot of great luck with treating this kind of anterior knee pain is with some foam rolling of the adductors and some foam rolling of the IT band towards the distal end of the IT band close to the knee. And these two structures have action on that patella through kind of fascial connections towards the anterior part of that knee. And so we've had really great luck with kind of decreasing the neural tone in these two structures, and then kind of reprogramming them or teaching them correct function through a side lunge. So prior to the runner taking off for their run and post run. The first one I want to show you is the foam roll of the adductors, and basically we're just going to have you get a foam roller, get down on the ground, pull the leg up, whichever leg you're going to foam roll, pull it up to 90 degrees. We'll do the right leg here on this video, and then we're going to place the foam roller parallel to our body and perpendicular to that leg that the hip's been at 90 and the knee's been at 90. And then we're going to use our opposite leg, opposite arm, and we're going to use those to push our body across the foam roller and roll that adductor, which is that big muscle on the inside part of your groin, from where it inserts close to the knee and into the fascia that runs around the front of the knee, up all the way to the more proximal end of the adductor, which is kind of towards the upper high end of your groin. It's not the most elegant foam rolling position, but it is effective. The next one we go to is then we have them work on their IT band, which is a structure that begins at kind of the top of your hip and then extends all the way down to the top of the knee, and then inserts around through some fascia around to the front and side lateral part of the knee. And we have them go ahead and foam roll that full area. And then towards the bottom of the knee, we have them actually, as shown in this video, we have them actually hold that position and then tack it down and then flex the foot to their butt. And so the way we foam roll the IT band is we actually get on our side, we put the foam roller underneath us, and then we put our front leg over the top of the top leg over the front of the bottom leg that we're actually foam rolling for support, to kind of take some of that pressure off if it's really painful for beginners. And we just kind of nice and slow go back and forth this area 2-3 times, but as kind of a glacial pace. And we do that with our adductors too. We'll go 2 to 3 rolls and at a glacial pace, so very slow. The receptors in the areas we're working on respond to low threshold but long duration application. So go very slow. You don't have to make it real painful. On a scale of 1 to 10, it should be 1 to a 3, no more than a 3. And then after we get both the IT bands and both the adductors, we roll them 2 to 3 times, very slow, maybe takes 30 seconds on each area. We get up and we have them actually do a side lunge, which is where we have them step laterally to their side, plant their foot, and as you can see in this video, then we have them sit back into that hip with the foot they stepped with, keeping the other leg relatively straight and the foot flat on the ground. And we have them sit into that to their depth, what they're comfortable with, keeping the knee tracking over that toe or slightly outside of it. And then once we get them to the depth that they're comfortable with, we actually have them pull that opposite foot up off the ground, flex the toe back towards their knee, keeping their knee as locked out as they can. And we do that in a 4-second count. So we do that lowering portion, 4, 3, 2, 1. And then we lift that foot and we we extend the knee hard. And then again, we come back up, we lower the foot down, we raise up out of the lunge, and then we switch sides and do the same thing on the other side. We're lowering down in 4. And then once we get to 4, and we get to the depth we're comfortable with, we're going to raise up that opposite foot, flex it towards our shin, keep the knee straight, and then we're going to put the foot back down, and then raise back up and go to the other side. And we might have someone do this 5 times on each side, and you can add these 3 drills, the foam rolling, the adductors, foam rolling, the IT band, and then the side lunge. You can add that to any warm-up that you would normally do prior to getting out and going for your run. But we've had people report really great results with these 3 drills for anterior knee pain. And it makes sense if you look at the anatomy. It makes sense. These 2 structures do very much influence the way in which your knee flexes. And if the IT band is too taut, or the adductor is too taut, you're going to get it to where the knee is either pulled one way or the other. And so you're going to get weird tracking with that patella. Or you may even, with the IT band, get a little bit of a twist. And so you don't get that patella and that knee flexing the way it should, which can lead to some inflammation and the pain, the generalized pain we see, but no obvious structural abnormality that we would typically think of, like ACL or meniscus. So this could be a great test, retest type thing. So maybe go on a run without doing it, see what your pain is after the run. Then the next time you go for a run, try doing this before, and then see how you feel after. And you might come to see what some of our clients have seen, which is the pain is either completely gone away or it's significantly reduced, which means that the drills work, maybe you just need more time doing them. So I hope this helps, and for you runners who are going to be getting out on the pavement with all this nice weather, I wish you luck, and I hope you stay pain-free. And again, if you guys are ever interested in working with us, please feel free to check out rsc.training or give us a call at 417-540-8870, and we'd be happy to meet you and talk with you and see what we can do for you.